and we're going to talk about low-intensity, long-duration ultrasound. And what again says the disclosure that I'm a consultant, I'm a manufacturer. So, sound is in medicine. We can all agree, right? We can bust up kidney stones with lithotripsy. We can take a look at the fetus inside of the mom as we're starting off with life. If you're my nurse practitioner, you can actually look at the routine with the cuff with an ultrasound. I can't do that, but thankfully she can, right? So we're using sound routinely within medicine. So the question becomes, can we influence the biology as well? So the Earth actually moves around the sun at 70,000 miles per hour. It also rotates on its axis at 1,000 miles per hour. Why does that matter? Because the atmosphere in which we breathe moves. When that moves, it creates motion, and that is sound. Again, just like I talked about, as a successful species on the surface of a planet with the sun, we have an atmosphere that's moving. And so our cells have evolved, and you can place sound to our cells and create a cellular reaction. And again, we have these two sensors on either sides of our brains and our ears that allow us to hear. So basically, this is part of who we are. And so we're going to share some information about how this novel treatment for the osteoarthritis is an option. We all know the osteoarthritis is clearly a budget buster for Medicare. It is like the #1 CBT code for aging people across our planet. And so the idea is, what can we be doing that's necessarily non-operative earlier in the disease process where we can help our patients? Because remember, total knee replacements, maybe 80-85% patient satisfaction. As good as we are, we're still not quite there with knees. So therapeutic ultrasound, so mechanical stimulation. We're going to basically use this ultrasound. Think about doing infrasound, 20 hertz, audible sound, which is where we are, ultrasound, which we're all familiar with. We have a lot of physical therapists, trainers that are here as well. And then we're going to talk about sustained acoustic medicine, which is the long duration, low intensity ultrasound as well. So when we think of standard therapeutic ultrasound, it's a higher intensity, it's a handheld module, 5 to 10 minute treatment, only happening in the clinic primarily, and there's limited energy delivery. So the concept of this low intensity, long duration ultrasound with lower intensity, we can get more energy to the tissue. So literally, this is a mobile device. Against put over top of the zone. We'll see it right here. There's a little battery pack. You literally can have your patient wear this for 4 hours. And so really pretty interesting. Because now they're moving, they're out there, they're getting treatment, and energy is the key. Energy is what keeps us moving. It is the biology that gets us going. So upwards of 18,000 joules of energy can be transmitted to our cells to be able to create a biological response. So how does this work? So mechanical transduction again. So when the meteorite wound up into the Cape Cod Bay about 2 weeks ago, you literally could hear that noise thousands of miles away, right? Because of our atmosphere and the mechanical sensation that happens. So mechanical transduction, what that means is that our cells have evolved to understand that and know that sound can create energy in action. So acoustic streaming, think of the extracellular matrix in which our cells live. That's where all of the nutrients are going back and forth. We're going to shake those up a little bit. We're going to get things moving a little bit better. That's the concept. And also, when we start building hands, we're going to increase blood flow to the zone so that we can get this healing response that we're looking for and create a biological effect. Is there evidence? And Jared McGuire said, show me the money. Well, and the first thing any orthopedic surgeon ever asked me is, show me the randomized controlled trial. Well, here we go. Placebo-controlled, double-blind study, 90 patients, mild to moderately overweight, Cameron Lawrence 1 to 2, 6 weeks of treatment. So what's the placebo? It's a sham device. So basically, the patient thinks that they're having it on, but there's no energy being delivered. And so therefore, we can then identify, take a look at improvement in pain reduction, as well as WOMAC scores to identify if there's a clinical meaningful results. And here you go. So when it comes to this RCT in particular, upwards of near 2-point reduction in their pain scores was significant by 2 weeks, better than placebo, means 2, 4, and 6. And consistent as well, sustained relief through 6 weeks as well. So here is real data to suggest. Now, WOMAC score again, these are functional scores to remind everybody. It's pain, it's stiffness, improved function, etc. And again, better overall WOMAC scores compared to placebo at 6 weeks as well. So how about a longer treatment EOA study? This is an interesting study because it's a crossover design. So the patient is the treatment arm and they're also the placebo arm as well. So So they get treated for 6 weeks, they go off for 6 weeks, and then they go on for another 12 weeks as well. So it's a 24-week follow-up study, crossover design. Again, this has a pain assessment as well as WOMAC scores as well. So pain reduction, 44% pain reduction at 24 weeks, with a 29% improvement in WOMAC scores at 24 weeks as well. So even greater improvement with longer treatment. This is unpublished data at the moment, but there are continual studies that are happening at this time with this device. So a lot of exciting data is literally being worked on as we speak. How about somnophoresis? And can we shake it up a little bit to be able to get some of these topical medications into the tissues deeper? The answer is yes. So by doing that, the streaming effect, it loosens up the extracellular matrix in the cells, and then the medication can actually penetrate in deeper microstreams, cavitation, skin permeability, so deeper penetration of medication. So how about that? Is there a process to be able to review this as well? How about SAM ultrasound with topical diclofenac? It's a starting place. 32 patients, again, moderate to severe DOA, once daily treatment for 7 days. SAM ultrasound used to enhance the diclofenac delivery, again, in a randomized controlled trial. As you can see here, pain scores significant 2.42 point reduction by the second week, 3.15 by week 8, and sustained benefit of LPS past 8 weeks as well as far as pain scores are concerned, and similar finding for WOMAC scores as well. So by pushing the medication into the tissues rather than having an oral form, waiting it to circulate throughout the entire body, we're going right where the problem is and getting the medication in a more efficient manner for these patients as well. How about the cost and overall cost to the impact on society as well? This is an interesting study. This is an economic analysis taking a look at therapeutic ultrasound again for knee OA. The study design was basically a little complicated. We're going to go through it, but basically starting off with a non-opioid treatment strategy, and then they're going to compare multiple different treatment options, and then we're going to run a whole bunch of simulations to identify if we did this in real time, would there be cost to reduction in cost to population-based medicine, right? We're going to run out of money. We have the best healthcare in the world. However, it's super expensive, and we always have roadblocks along the way. So here's the study design. You can see here, if basically, if there was pain improved, they just continued with physical therapy. If patients did not get better with their knee osteoarthritis, they were then moved into various treatment arms. Corticosteroids, HA injections, supervised physical therapy, as well as escalation advanced care as well. Then with literally 1,000 Monte Carlo simulations, we're going to keep doing it over and over and over again. We're going to see what kind of cost savings could potentially be there. So you can see here, strategy number 1, starting with SAM treatment, then it's not getting better. Okay, let's go to HA, then let's go to total knee replacement, and eventually death, versus doing HA injections, total knee replacement, death, or total knee replacement from the start. So the question is there a cost savings potentially associated with early use of the disease modification of these things earlier on in the process of how we're dealing with our patients? So again, 98.5% probability that SAM, the device, Sustained Acoustic Medicine, was cost effective. So better quality adjusted outcomes at 6 months, lower costs, and eventually, cost effective as well. So we're coming to a close. The bottom line here is that my mission is to sort of disrupt the way in which we think about the classic methods in which we treat our patients. I'm very excited to be able to come up and share about the ACL bear, as that also is this biological process of how we're trying to convince the human body to be able to heal itself. It has the ability to do so, and by thinking differently and incorporating all of these various aspects, whether it's nutrition, the physical therapy, the light therapy, ultrasound device, all of these things create and stimulate a healing response. So anything that can help our patients early on in the disease process, clinically effective. We showed you some clear evidence of that, as well as the fact that these could really be very cost effective for society as we move towards the process as well. So thank you very much.